Good afternoon, everybody, and thank you for joining us. It is October 23rd, 2020, and you've joined us for the CAF COVID Weekly Roundup. My name's Jason Belden. I'm the Director of Emergency Preparedness for CAF, and with us today, we have two guest speakers, Deanne Walters and Patty Owens from CAF, our Director of Clinical Affairs and Director of Regulatory Affairs. They're going to be joining us to discuss some of the content that we have. We're going to cover vaccines, information about vaccine registration. We have a limited time to get that stuff done, so Deanne's going to cover that. We'll talk about the Echo Hubs. There's another limited time to sign up for that, and that's why we're concentrating on those. And since it's a slow news week in terms of AFLs, we're going to do some, in case you missed it, review. We've had I think all of us, Patty, Deanne, and I, we attend those the CDPH calls, and we've seen a lot of answers to questions given verbally that conflict with the written guidance that CDPH has issued. And so we'll review those and then talk about what our strategy is with CDPH as we go forward. With that, let's hop right to it, and not to forget that CAF.org resources coronavirus has all of this stuff that we've created along with the AFLs and things from our national association are contained on that page. So just as a review, what we the intent of these webinars is essentially to give you guys a situational report with things that have happened with the state over the last week and the feds. We talk about forecasting what we anticipate may happen in the future or what is likely to happen in the future for you guys, as well as highlighting best practices where we can. Sometimes we'll give our personal opinion, and when we do that, we'll try to differentiate that from CAF's official position. One of our first things today will be to talk about a CAF official recommendation. Deanne will go over that in a second. And then these webinars are brought to you from a grant-funded program with CDPH, and we have no financial conflicts. All of us are CAF employees. All right, so today's this week's updates. Well, we have no AFLs that came out or that were effective for us. Is that correct, Patty? This week, nothing so far.
That is correct, Jason. We're still been waiting for the much anticipated new revised visitation AFL, but that still has not dropped.
Okay. All right, perfect. I wanted to check just in case it came out this morning without us noticing it. So no AFLs this week, but we do anticipate next week we're going to see at least a couple, probably visitation, although we keep saying that, and maybe an AFL on cost payments, but we can get to that towards the end. And I wanted to talk a little bit about persistent positivity. As you guys are going to continue to do screening testing for the foreseeable future, even after we get a vaccine, we're still looking at months and months of testing. So you're going to run into this case, or possibly run into these cases where you have either residents or staff that are post 90 days that could potentially still test positive. And we've heard the kind of guidance from CDPH to talk about, well, treat this person as a new case until you can clear that case. And we've seen some counties give some variance to that, and specifically Fresno County sent a really nice kind of explanation as to how they do it, but it was more of a kind of a thoughtful approach to that. What I'm asking of you guys, if you guys have those conditions, please let us know what your county variance is. If your county is allowing you to bypass the twice weekly or the twice requirement to test all the residents twice, any kind of change from that on a county level, we need to know about it. I've heard from other counties that have strictly said we treat this as a new outbreak until we've gone through the outbreak or the response-driven testing. And then after the first round of response-driven testing, if we have no further cases, we'll review it at that point. So I think that's probably what most counties are going to go with, but we want to, if you guys have conditions where you're not allowed to accept new residents or you're put on an admission ban because of this, we want to know about that specifically with the county and how they're accomplishing that. We'll reach out to the counties to find out that information and pass it along once we get it. And then I want to talk for a second about this new grant opportunity that CAF is going to be doing in Los Angeles County. It's called the Pioneer Program. And Pioneer has an acronym. I'm not going to go over the entire acronym, but essentially what it is it's a monitoring device that gets connected to the generator of the facility, and it's going to be combined with a quick connect device. And what the goal of this is for facilities that are in the PSPS territory, we're going to install a remote monitoring device combined with a quick connect device so that a temporary generator can be brought to the facility, and the infrastructure is already built to support a temporary generator. So all you would need was the generator to connect right to the quick connect device. You wouldn't have to install it once it came. This is a demonstration project that the County of Los Angeles is doing. This will be the first of its kind in the entire country, so we're pretty excited about this, and the cost is going to be covered. Right now, what we have is 18 acute hospitals and 5 subacutes in Los Angeles County that we're going to install these things on free of charge. The goal is this is going to be hopefully eventually available to every facility in the state, but we've got to do this demonstration project first in order to justify the cost for this. So the cost can be absorbed by the facilities. If they wanted to install something like this, they could do it at their own facility. But let us figure out how we get through this demonstration project first, and then we hopefully can get some money from Southern California Edison and PG&E to help pay for that. And so I talked about the new tool that CAF is going to have. We also have a new lab associate member. For those of you that are still searching for lab resources, this is the first lab that we brought on as an associate member. We've not had a lot of luck getting labs into kind of the CAF overview, but these folks have plenty of capacity. They're based in Irvine. And so if you're still looking for resources for lab testing, I would give those folks a call. All right, so let's hop to the next slide where we talk about vaccine registration. I'm going to turn it over to Deanne. I know you guys have probably been beat over the head with this week, but it's really important that we get this information to everybody as quickly as possible. So Deanne, please go ahead.
Sure, thank you. Well, as Jason said, obviously you've probably heard nonstop about what's happening. The federal level announced that there is this pharmacy partnership that includes both CVS and Walgreens, and the program is set to assist long-term care with getting the vaccines into the facilities to be given to the residents, and then secondarily potentially the staff. So mostly it's a focus on the residents in this round. So what they are asking is that all of the facilities, and this is both skilled nursing and the ICFDD facilities, that they all go into these 2 different registration formats and sign up for the process that you would like to choose. And CAF's position is that, we want people to sign up for this program. The reason is just because of the streamlined process it's going to offer all of our facilities throughout California and the nation, because the vaccine will be brought on site. You don't have to worry about the cold storage issue that most of these vaccines would require. They will provide all the resources, the personnel, the PPE, and the equipment to vaccinate your residents. And then also, like I said, potentially other staff members as well, if they haven't gotten their vaccinations through other sources. So you want to get into this. The last day to sign up is next Friday. So again, it's a big push. We want to see as many of our facilities throughout California signing up. You can also opt out. So you don't have to choose to go through Walgreens or CVS. They do have an option, and the 4 options would be to go through your own partner. But then you do need to ensure that they are able to handle all of the parts. They have to be agreeable to and meet the requirements. So, and then of course you can opt out, but then you do have to have your own process in place in order to provide the vaccines in a safe and effective manner to your residents. So task position is, take advantage of this process that's put in place to make it easier on you. And so Jason's just put up on your screen the vaccine registration through the NHSN. And of course, this is that fun site that we have been dealing with throughout this COVID pandemic. And it is a challenge to work through. But here on the page kind of walks you through how to access the option to choose. So, you're going to go into the application, sign on. Hopefully everybody is at the level where they have their SAMS grid card. And then once you log in, you're going to go to the reporting section. On the page that looks like a calendar, there is a link now that says long-term care facility component, and it talks about the partnership. So it has the name, the partnership on there, and then you click on that link, and then you're able to make the choice from those 4 options. So we want everybody to take advantage of this opportunity to save you from all of the procedures that you'd have to go through if you didn't do this. It's going to save your staff time. It's going to save you reporting. It's going to save you in regards to the equipment, the PPE, and it will bring the vaccine in a much faster pace into your facility to help your residents. So that is that vaccine registration.
Oh, I was going to say, can I mention something on that? One of the other things that we learned this morning from our national association was that when you go in to sign up, you can choose your own long-term care pharmacy. So Dan talked about those 4 options. So one is CVS, one is Walgreens, one is your own long-term care pharmacy partner, and the 4th one is opt out. And if you're going to choose your long-term care pharmacy partner rather than CVS or Walgreens, you can do that at this time, but just know that whoever your long-term care pharmacy partner is, they're going to have to meet all of those requirements that CVS and Walgreens have already met. So the requirements for cold chain storage and distribution and reporting and all of those things, they're going to have to go through a process to be approved to do that. And so they may not get through that process, or they may get through that process. If you want to choose either one of those 3 options just to get you in the portal and get you kind of logged with your desire to be included in this process, that's really what we recommend. We want you to at least indicate that you're going to use this service for your vaccine. One, I think it's going to be much easier to go through this process rather than do it yourself. 2, if you choose to do it yourself, you may be amongst the last to receive the vaccine. So that's pretty important. You might not be in the tier 1B, or you might be at the end of 1B tier. And so we strongly encourage you guys, you can always opt out of the service after you've gone into it. We don't know what will happen once they close the registration if you try to go back in to register. We think you'll be able to do that, but we don't know how easy or what the process is going to be for that. So we recommend that you guys go through this process now. And then on the screens, you guys can see the bullet points for each individual step as you go through this registration. I'm not going to go through it all because it won't make sense unless you're actually doing it with us. But Deanne was kind enough to give us the step-by-step directions with screenshots of that, and that's included in one of the handouts. So I just wanted you guys to be able to see what the steps are. It's kind of a 10-step process, and there's screenshots on the slide or on the handouts that'll walk you through what it looks like for each one of those steps. And Deanne mentioned the REDCap site, and this would be for non-NHSN reporting entities. So assisted living, intermediate care facilities, RCFEs, those folks will sign in through this site. The tier priority is the same for residents of nursing homes and residents in assisted living facilities. These folks are going to be on what's called Tier 1B, and I'll talk about what Tier 1A is in a second. But if you're an ICF facility and you're listening to this, or if you're a CCRC, you may have to go through this site to get signed up for your residents on your AL side. I went through the process last night. The website is really buggy. If you decide to click in the middle of, it's a bunch of text boxes. If you don't go through the process, step one, step two, step three, if you try to skip forward in the process, it causes an error and you have to restart the whole thing. But once you kind of input that first section of information in terms of, picking your home, putting your contact information, all that information in there, once you get past that page, it's really easy. You're going to be given the same choices as the NHSN thing. So you're going to have 4 choices. You're going to have CVS, Walgreens, pharmacy partner of choice, or opt out. You're going to have to put in the number of beds and the number of staff, and then you're going to click submit, and that's going to be it. So it's a relatively straightforward process for you guys, much easier than the NHSN reporting stuff or site. If you have questions with that, please forward them to me or to Meredith, and we can work through those problems with you. So I mentioned Tier 1A and 1B, and sometimes this is a little bit confusing. So I want you guys to understand, in terms of the vaccine, Tier 1A is going to be for our healthcare workers, and that tier of vaccines is going to come to the state, and the state is going to distribute that. Now, the state has a plan that they released on Monday of this week that they submitted to CDC. It looks fairly straightforward and nothing out of the ordinary. We do know that the staff members are going to be prioritized as Tier 1A, and there may be little buckets within Tier 1A of priorities. So frontline staff would be first, and things like EVS staff, whereas maybe administrators might be on the back end of that Tier 1A distribution. But anyways, those will come from a different place than the vaccines for your residents. So now, as it stands with ICFs, we're not certain whether ICF staff are going to be included in that Tier 1A bucket. So it's important to make sure that you have your staff documented, the total number of staff that you're going to need vaccines for on that survey, on the REDCap sign-up site. All right, so hopefully that explains how we're going to get the vaccine to you guys. And if you have questions, please put them into the chat box, and we'll get to that at the end. And now I'm going to pivot back to Deanne to explain the Echo Hubs, and this has a really short turnaround time for you guys to get involved with this as well. Deanne?
Absolutely. Actually, it's very exciting that we are going to be having this opportunity. This is something that has not come in the direction of skilled nursing facilities ever before. So we are going to have this Echo Hub available to our nursing homes, but it's happening now. So we have, again, until next Friday, they just, through HSAG, our quality improvement organization, they extended it now through, I believe it's Tuesday. And so that puts us to the 3rd to get everybody signed up. And this truly is for every skilled nursing facility in California. There are different echo hubs that are happening at the very same time across the country. During this training, it will be 16 weeks starting November the 9th, which is why it's such a short turnaround time to ask people to sign up. But within that, you are going to have access to some terrific experts. HSAG, who we all know as our QIO, is partnering as a hub along with Stanford Medical in order to bring that expert level of interaction for learning to our nursing homes. So they want at least 2 people from every facility to be on these Zoom sessions. And, like I said, there's 16 of them. They're an hour long, but of course, the team that is on that call, which will include all of those clinical experts, will be staying on for like a half hour at the end of each session in order to do that one-on-one question answer session for you. So some of the things that you can't get your voice heard on with some of the other calls, you can have a much smaller group, this 30 group per cohort that they're going to have. And so you're going to have the ability to ask very specific questions about your situation and get them answered in order to continue to improve your efforts around preventing COVID. So the goal is, like it says on the slide, to advance improvements in our COVID-19 preparedness, safety, infection control. And so it's really a great opportunity. I am trying to keep an ear into both HSAG and Stanford in order to make sure that we are aware as an organization to know exactly where they're going and how they're arranging these things to make sure that it really is skilled nursing center focused so that it meets the needs. And so the really great thing is if you do participate each week, you have at least 2 people in attendance at every session over that 16 weeks. The facility can receive a $6,000 stipend for participating. And in the past, we do get education from our QIO, but truly this is the first time ever we have ever seen any significant money for participating. Now, that's great, but truly the benefit will be the education, the level of sophistication that the individuals that will be coming to us with information. That's really where we're going to get the most out of this. So we want all of you to join into this ECHO Hub. Where you can go is right there on your screen. It would be echonursingHome.stanford.edu. That is going to take you to the web page where it has most of the information and your ability to sign up. And right now, the sign up is just saying, I want to be a part of it, and we want all of you to be a part of it. Later will come a contract, of course, that will be required just so that it lays out what your responsibilities are and what you'll be receiving through this project. So it's really, really exciting. Hopefully you have lots of questions that we can answer for you around the ECHO hubs. But again, short turnaround time. We want you to hop on and get yourself signed up. I think Jennifer Wachowski from HSAG mentioned it on the call both on Wednesday and Thursday. And so I believe we are already about 230 facilities that have indicated their participation. We really want to make sure all 1,180 of our facilities across California are involved. And they have the staff in order to make those cohorts about 30 to 35 each. You'd have your own time and you'd be able to get that one-on-one with these experts. So it's a very exciting program.
Hey, Deanne, I'm just thinking further ahead in terms of the infection preventionists required education. Is there an opportunity, do you think, to use some of this towards those requirements for the infection preventionists?
You know, I would absolutely think so, just because this is getting one-on-one education at each session. They will do that didactic portion, which would be about, 20 to 30 minutes of it before they jump into a case study. And so you should be able to use it, because that requirement is just for advanced training in infection prevention. But I probably wouldn't stop there. If I was the infection preventionist, right, I would be doing, the CAP Infection Prevention Conference, and I would be doing other things in order to really have my head wrapped around everything that needs to be done. But if you are the infection preventionist on this for 16 weeks, then yes, I would think that you could utilize your attendance as part of that advanced training for infection prevention.
I'm just looking for ways to do two things at once. That's all.
Absolutely. No,
Yeah.
I get it. And it does say 2 attendees per facility, but as you all are in and around out there in your facilities, try to have more people, because it's really hard for 2 people that work in the facility to share that information out to everyone, because the didactic part where you're going to receive some learning and education really needs to be filtered and deployed throughout your whole facility, top to bottom. People need to know about what's happening and how to respond to COVID. So that's really important. So if you have 5 people from your IDT, a CNA, and a housekeeper that can join, that's even better. So, but you need to have at least 2 attendees every week. And then in the case study, again, they're going to ask you as the facility to say, hey, this is something that happened. We want to get feedback on how we can maybe do it better. So you present your case to the cohort that you're in, and they'll of course explain how that happens. And then hopefully one of those weeks they will be able to review that case, and really as you're reviewing the case study, you're picking up and learning about how to really dig deep into situations that you come across as the infection preventionist, or as a nurse in the facility, or even as a CNA. How do you deal with these situations? What's the best way? How do you put things in place in order to prevent those gaps and basically allowing the virus to get in? So really take advantage, be ready with those case studies. Don't be shy. We need to speak up and have our voices heard.
Awesome. Whoops.
You're welcome.
All right. So since we have a kind of a slow news week in terms of AFLs, I think Patty, Deanne, and I, and everybody that listens to the CDPH calls have some questions about, kind of answers that they've given that seem to conflict with the written guidance. And so in case you missed it, on one of the calls earlier this week, there was a question about extended use of PPE and removing the N95 respirator when you move from the yellow cohort zone back to the green cohort zone. And I'll just say, I searched the CDC guidance for a reference for that explanation on the call, and I was not able to find it. And I'll give you this: the CDC is not great at putting everything in one box, but I've looked just about everywhere to see where this is a requirement. And Deanne has reviewed this as well, and neither one of us can find it. I will say that CDPH released an attachment with their AFL that talked about extended use that would seem to conflict with the information that was given on that call. And I want to point your attention to the very last bullet point here. This is right out of their own guidance, but it says respirators should be removed and stored in clean paper bag before activities such as meals, restroom breaks, or other breaks, and then redonned and worn through the remainder of the shift. There's nothing in there that says you need to take it off when you move from yellow to the green zone. There is some talk about the red zones, but depending on if you've got a true red zone with dedicated staff, that's less of a concern. We know that the yellow zone is kind of a fluid metric, especially if you're taking new admissions. So Our hope is to get a conversation with Vicki Keller and Dr. Epson next week to resolve some of these issues. It's not just this, it's a number of things. And I think for the most part, CAF and CDPH have really followed lockstep in terms of clinical guidance. But recently we've come into some real problems with what they've recommended. And so we'll cover that in a meeting with them. But definitely, I don't know that that's even possible, and it kind of defeats the purpose of doing extended use if you're constantly having to remove it. If you're moving from, let's say you've got a yellow zone and your yellow zone is one room. You can't give dedicated staff to that, and that means that every time that person leaves that, they have to take off their N95 and put it in a clean paper bag. Well, we can only take them off and put them back on 5 times, and then we've got to discard them. That we know that from Cal OSHA. So it kind of really removes the ability to use these for extended use if we're constantly having to remove them. So we'll get that cleared up. I know there's questions in the question box, so I wanted to speak to that specifically. Patty, did you have anything else you wanted to add in regards to what you heard about the extended use, and maybe anything else I missed?
Jason, this is Deanne. While Patty's getting to her mute off, I just want to say that just make sure that you really are in the extended use and have your documentation so that it can reflect the fact that the availability of those N95s is such that you need to do extended use. Because once you are out of that situation, you should be going back to regular use. And so you need to make sure that it's well documented that you're still on a limited supply so that they can't bring that to you instead.
Yeah, and that's a big difference in how many masks you use, on a daily basis, to go from a disposable to, something that you wear all day. So you've got to kind of factor that in and be able to document and justify why you're on the extended use rather than, disposable use of that, of those things.
Absolutely.
All right. And so I want to cover some other real quick bullet points because I hear this asked on questions. I've talked to providers that still go, I have to fit test people, and I still hear questions, real basic questions on the HAI calls. Fit testing is required for any employee expected to wear a respirator. So if you've got a yellow zone or a red zone, or you've got anybody that has to wear an N95 in the course of their duties, they need to be fit tested prior to that. And so how a lot of people go, okay, that's great. How do I fit test my employees? Well, you can get some training and you can do the fit testing yourself with a qualitative fit test kit. Those fit test kits can be purchased from your traditional suppliers of equipment and stuff like that for our facilities. They are in short supply, so you may have to search around for fit test kits. The solutions, so there's like a bitter solution, there's a saccharin solution, so a sweet solution that can be used with the fit test kits. They're like they spray the aerosol inside the hood to see if you can smell it, whatever the source is. And those are also hard to come by. The point is, you're going to have to search for all this stuff because this fit testing requirement is not going away. And if you've not done it and you're not actively searching to do it, you're going to put yourself in a world of hurt with Cal OSHA if you get an employee complaint. So you've got to do it. You've got to find a way to do it. Occupational health companies may have access to fit testing. So who do you send your staff to for drug tests and pre-employment screening? They may be able to assist. There are separate companies out there that do that as well. Those companies are generally very expensive on a per person basis. But all of those things need to be done, and you need to be documenting your efforts to source these. I'm scared for you guys what's going to happen with Cal OSHA after this is over. if you've not done this. I really am. It's really important, guys. And for your financial future as a viable business entity, this is going to be really important for you guys, because you could see hundreds of citations coming if you've put people in the field without fit testing them to an N95 respirator. Now, I realize once they've been fit tested, you can't necessarily give them the mask that they were fit tested to, but that's a whole different, responsibility. And we've got, we can document those efforts, and those are well documented, not just in our industry, but in hospitals as well, that all those folks went through the fit testing process, but they can no longer get the mask that they were fit tested to. That still doesn't absolve you of the requirement to have them fit tested first, though. And so I don't want that to get lost. And it's important for you guys to do that. So I know we didn't have a ton of stuff on PPE other than those two particular things that I continue to hear. I did include that CDPH guidance on the PPE use by cohort category, and that's included in the handouts. Another one of the big things that we keep hearing is, do I have to wear eye protection in the green zone? And the answer is yes, that is on the CDPH guidance. And so if you're hearing that for the first time, that just means that everybody should be wearing eye protection as well. There is some nuance within the category that they say, you have to be doing patient care. My suggestion is, rather than keeping that or taking it off, cleaning it for each use, is to implement extended use if that's easier, rather than taking it off after cleaning after every change. So I believe that the CDPH is okay with the extended use of the eye protection as well across cohorts, but we'll discuss that with them next week. But the reality is, yes, you do have to wear eye protection in the green zone. All right, so now I want to talk about the antigen testing, because we've just, this thing is just crazy. I'm sure you guys are as frustrated with this as we are, and if you're not, it's probably because you're not planning on using one of these devices. But I'll say that the guidance is difficult to interpret. I included as a handout the guidance that CDPH gave to us, at least the PowerPoint that Dr. Epson gave to us. Now, we've heard them answer questions differently than the written guidance that was given to us. So I just want to go over the kind of 3 buckets of testing and what we understand the allowances are by bucket. So let's say you've got a symptomatic healthcare worker. Any positive antigen test with a symptomatic healthcare professional or resident does not need a confirmatory test to confirm that they're COVID-19 positive. Now, if they're negative, you would obtain a confirmatory PCR test, and you would manage them as a suspect COVID-19 person, put them into your yellow zone. For the screening testing, any positive antigen test result, in their guidance that they gave to us, is confirmatory testing is optional. Manage as confirmed positive and consider confirmatory testing in areas with low transmission. Now, that has been the one that's been gone back and forth, and I've heard different things responded verbally on the call. This is what I've got in writing, so I'm going to go with this is what the allowances are for now. The negative antigen test results for screening healthcare workers, no confirmatory testing needed, as long as the individual will continue to be tested regularly. So as long as they're going to be tested every week, a negative antigen test result can be accepted in the screening. Response testing. So if you're doing response testing and you're using the point of care testing devices in your response testing, and you get a positive antigen test result, no confirmatory testing is needed, manage as confirmed COVID-19 positive. If you get a negative antigen test result for response-driven testing, you're going to need to obtain confirmatory testing with a PCR. Manage is COVID-19 exposed, meaning they're considered yellow now until you can get the confirmatory PCR testing. So all of that being said, there's a lot of nuance to that. There's a lot of ways to misinterpret this or to have these folks get it incorrectly. The reality is, if you combine all of these things, it really kind of indicates that CDPH is not super well. I don't want to give my opinion about that, but I do know that they're very cautious about recommending this, and they really talk about following the package insert or the FDA EUA approval, which talks about symptomatic residents. I'll just say we've heard stories that these tests are a little less reliable than the PCR tests. We've had anecdotal stories and a couple of documented stories of false positives. All that being said, we don't know your experience. So unless you tell us you're getting these false positives, we just have to kind of take these with a grain of salt. I'll say CDPH really wants you to concentrate on using these if you're going to use them for the symptomatic residents. And we talked about what actions you can take to do that. All that being said, the reporting requirements are about to get more complex. So the federal government is going to send a request to every facility in the country to report your antigen POC testing devices into the NHSN. And there's going to be a separate NHSN kind of module for reporting these test results. And so that would be all this stuff we're doing to CLIA. We don't know if we're going to have to do CLIA reporting and NHSN reporting, or if the CLIA reporting we're doing through CalReady is going to be then sent to NHSN for us. Many of these things have not been figured out. We just heard about this morning, but the anticipation is that the reporting process is going to get a little more convoluted, and there's a requirement to have a SAMS level 3 password with NHSN, to get in to implement the thing. So our first recommendation is, one, find out whether you have NHSN SAMS level 3 to get in. That there's about 700 facilities in the state that have that, but there's about 500 that don't. So you'll need to find that part out. And what we'll do from the state is we'll find out if you've conferred your rights over and you're doing the CalReady reporting already. Will CDPH do the NHSN reporting for the positive and negative antigen test results for us? So we'll find that information out. We expect this is going to have a short turnaround time. And we think that CMS is going to require this. Well, they said it's immediately implemented, but they're going to give a glide path to start doing this into November 20th, I believe. So it gives us a week or so, or a couple weeks to figure this out with CDPH before you drop that date. So more on that to come, but definitely, they just add more and more of these requirements on.
More layers.
More layers. And, if I was, I don't know. If I was a cynic, I would say that they're really trying to discourage us from using these devices. The good news is hopefully our lab process and our lab partners continue with their ability to meet our needs in a timely manner. We don't know if that's going to continue to happen, but hopefully you guys are experiencing that in the field. If you're not, please let us know. If you still have a lab that's taking more than 48 hours to report the results, or you're having issues with logistical problems, please let us know. The lab, the name of your facility, the county in which you operate in, and we can see if there's other resources out there to help you out with that. So Patty, did you have anything else you wanted to mention on the antigen testing? I know I just kind of blew right through that without calling on you.
No, I really don't. We'll keep you guys all updated in real time as we learn more from CDPH on the new uh, guidance issued to state agencies from CMS, and I'm sure this will be a busy week. I'm sure CDPH will also discuss it on their call, hopefully this coming week, and that we can get clarification as soon as possible out to everyone on it that is using the antigen testing. We're not really sure. We don't have a lot of providers. We haven't heard from a lot of providers. We're not really sure how many of you out there are using the antigen testing and how is it going and that sort of thing. So if you have any stories on using the antigen testing and you wouldn't mind emailing Jason or I to let us know how it's going for you. Is it going well? Is it not going well? And any roadblocks or any about it. Just to give us a general idea of what's going on with the antigen testing out there would be awesome. But that's about all I have, Jason.
Yeah, no, that's perfect. Especially if you get like a false positives. If you guys are getting any of those cases that you're turning around and then testing them with PCRs and you're finding out that those are false positives, please let us know that. That's it's important for us to pass that information along to the state as well. So. All right, I'm going to hop to questions here. Please, Deanna and Patty, stay with us here because we've got some questions and hopefully you guys can weigh in on some of these things. So,
Absolutely.
First question, is there any clarity now regarding testing of non-payroll healthcare providers? I've asked twice on the CDBH calls and got no answer. And I'll say that we've also asked and are still
Well, Jason, I'll jump in on this one. I have this one out with Heidi at a higher level because this has come up. We've actually heard different speakers on different calls through the CDPH calls say different things. So it's been kind of inconsistently messaged out, and we have let CDPH know that. We're asking for their clear direct view because directly from Heidi it was stated that it's not. It's just on your because CDPH has no way to mandate people who are not residents or employees of the facility mandate anything for them because they work for other agencies or they work for other type of entities. So right now, as it stands, it's about as clear as mud. As that's what I can say. We're trying to seek because of the confusion in the messaging by different guest speakers. So we are going to, as soon as we get that clearance, we'll get it out on this next Friday, or we'll get it on the CAF forum as soon as I get that email back. Okay.
Perfect. Thank you, Patty. I appreciate that. Yeah, and I know that's a big point of contention. A lot of people have that question as well. So as soon as we get it, we'll put it out as quickly as we can. So next question is, Walgreens or CVS going to go out to the long-term care facilities and administer the vaccines? Yes, they are. Regardless of whether you're a SNF or an ICF or what type of provider you are, if you choose the Walgreens or the CVS option, it's meant to be an end-to-end solution. In other words, yeah, you're going to have the reporting, so the vaccine reporting requirements are going to be handled by them. The cold chain storage, the delivery, the actual administration of the vaccines, all of that is going to be done by their mobile clinics. So that they call it a mobile clinic. They're essentially going to have, some kind of healthcare staff come out and administer the vaccine and take care of everything.
They're going to do 3 in-house clinics at your facility for you. The first one will be administering the first round of the doses, and then the second one will be to do the second round of doses and maybe the first round for the first round of the straggler employees who haven't gotten it in a different way. And so they'll be doing 3 in-house clinics, and even if you're 75 miles or further from a CVS or a Walgreens, they'll still figure out how to get to you. And it'll be 3 distinct clinics at your facility. They do everything. They'll do all the billings. They bring the supplies. So overall, it's really going to help the facility. I do want to add one thing here, Jason, if okay. I've had a lot of member questions regarding, like we do annually for the flu or for other vaccines, about the consent forms and physician orders and that sort of thing. Now, federally wise, on all the calls with AHCA, we've been hearing, oh, you don't need this, you don't need that for the consents or the declinations that we typically do. However, because we're in California, that brings in different layers of regulatory requirements, also specific HR issues or liability issues. So we're going to run it through the legal committee as well to look at all the California requirements. And the biggest thing is right now, we aren't even sure which vaccine they're going to be sending us. So in each facility, what type of vaccine is going to be used. So you can see how complicated that would make it to have the consents and waivers and the VIS statements ready to go. And review the risk benefits. So yeah, that would be done further along the line. I know a lot of people have asked now, but right now we just are doing the 2-week window to sign up. All of those other things will be answered as more information comes through. And we're putting this on the agenda with CDPH so that we can make sure members know exactly what California law and regulation and HR and all the legal issues are going to require here for California. And then we'll make sure we help get some forms developed for our membership if and as needed as well.
Yeah, no, that's a great point. Dr. Gifford brought that up this morning on the call. He said that those VIS statements, the informed consent, kind of things have not been developed yet because they don't know what vaccine it is, but they're in development now, and they should have those pretty quickly after the vaccine is approved, whatever one it is. I know the Pfizer one is in the lead right now, but that doesn't mean that's the one we will get for our residents. And I just want you guys to know that the process that Patty just described is for our residents and any straggler staff. The staff are going to be handled differently, and that the staff vaccinations may not be a program where somebody comes out to you. It may require us to send staff somewhere because of the cold chain storage requirements. So we don't know that yet. That'll be depending on whether it's the Pfizer vaccine is the one that is accepted first, and that's the one that has the really crazy kind of cold chain storage requirements. I just want to differentiate. Yeah, go ahead.
Oh, yes. I wanted to add to that, and thank you for saying that, because as Jason just said, as that becomes more clear, then we'll know the legal aspects and the regulatory aspects for the residents and differentiating the residents' requirements and the employee requirements based on what the facility's obligation is to do as far as what we're used to doing.
All right, so we've got a question on Echo Hubs. For the Echo Hubs, can just one person sign up for the facility for now, and once details come in, 2 users will be on, or do we need to have 2 individuals signed up?
No, you got it. Sorry about that. That was confusing. You just want to sign up for the facility. So they're not going to ask you for any individuals that are going to be participating at this point in the game. It is just you're signing up the facility as a participant. And then, yes, they will reach out to you with additional information and then provide you with all the information. And then you would work directly with either Stanford or HSAG, depending on which which cohort you're put into. So for right now, it's just your sign up the facility. You don't have to designate which staff members will be attending. And then as you get into the program, then you would probably want a lead for your facility that is constant throughout in that program in the 16 weeks. But sign up for the facility, the individuals can come later.
Perfect. I've got one more question on that, Deanne. Is there a way to check, not on the Echo Hub, sorry, the vaccine registration. Is there a way to check if the vaccine registration was completed and received? Or do we know?
I haven't had anyone ask that, but I think that you could, well, I mean, if you're the skilled nursing, you could just go back into the NHSN and ensure that it is indicated there. but we would have to ask and see if there's some special way. At some point, you will receive a message from the either Walgreens or CVS, whichever your choice was. They will contact you and inform you that you have been assigned to the specific one. But if you're concerned right now that you're registered, then I would just double check in the NHSN to make sure that it's designated.
Yeah, and it's possible that person that asked that question was an ICF. I don't know. I know when you do, you submit the form, you just press submit and it goes off. I'm assuming that you would get some email confirmation, and if you've not if you went through that process and have not got some email confirmation, please contact me or Meredith, and one of the two of us can track down how we can find out if your registration was completed and submitted. So, all right. Could other providers join the training even if they don't get the money, or is this only open to SNFs? And I would assume she is referring to the Echo Hub. Is it only open to SNFs?
Yeah, well, it is at this point just a skilled nursing facility. If you are part of, say, a campus and you're in assisted living, then you could potentially sit in the room with the other people from the skilled nursing to glean that information. But it is going to be specifically where each facility is assigned to a certain time and a certain hub, whether that be Stanford or at HSAG. And so that will be very particular. So it's not just like a once a week, 1,000 people on a call. It's a very small, intimate group that they will be having these conversations in. So if you're connected with a skilled nursing facility and they're open to having you participate in that call and in the learning, that would be great. But I don't believe there's any outside registration that they are going to be having. I know they're going to put some stuff on the website that you can access that might work. So if you go to the website that we gave you in the presentation, they should be posting up some information and learning there on that website as well. And those should be open to anyone.
Yeah, that's perfect. So the next question is, I think this one's for me. What is the rationale for putting an N95 in a paper bag? Well, the initial talk, if you think back to when we started this, when we were talking about, reuse or extended use, how do we keep these respirators in a place, a safe place, where they're not going to get damaged? And I think the paper bag change was because people were putting them in plastic bags, and plastic bags were not breathable. So the question goes on to ask, could we set them on a paper towel? And I guess that, accomplishes the same thing, but I'm certain that HAI would have an issue with that, because they probably want it to be, in a paper bag so that, it can't be disturbed, and any potentially infectious materials that are on the outside of the mask could be re-aerosolized. And so they're thinking by putting it in a paper bag rather than just setting it on a paper towel. It's a really small difference in risk probably, but I can see why they would recommend a paper bag versus just setting it on a paper towel. And we know the reason why they don't do the plastic bag is because the plastic bag is not breathable. So.
Well, and I think the paper bag also helps absorb any moisture from the N95 filter, because really you want to keep that filter as dry as possible.
Yeah, perfect. All right, so remind us what ICYMI stands for. ICYMI stands for in case you missed it. So it's just a, it's a text abbreviation. I'm not young enough to know when this came about, but I've seen it and I just co-opted it. So, but it stands for in case you missed it. NHSN link only has the choices for pharmacy, does not have the choice for pharmacy partners. I've not gone through the process. On the process, do they give them the choice to pick their pharmacy partner in NHSN, Deanne?
On the the screenshots that we sent out, it should be able to show you what exactly it looks like. What I have seen, because of course we don't have facilities, so we don't have NHSN access. So this is only by what I've seen on the screenshots or heard from, is that when you're looking at the page that looks like the calendar that shows that you have turned in the testing data on that daily calendar looking thing, at the top of that, there's a link that says the partnership pharmacy or the pharmacy partnership. And if you click that, it takes you then to the page that gives you those 4 options. That's, I'm not sure if that gets you to that question, if you're seeing something different. If you're seeing something different, you can send an email to myself and we can hook you up with others that can walk you through that in case you're not seeing all the options that you're supposed to be.
Yeah, and that's perfect. And it does not have questions of number of residents or staff. They're going to gather that data, I think, independently. The questions about residents or staff are just if you're going through that red cap sign up. So
correct. Yeah. So the pharmacy will do that you choose, will reach out to you to schedule, like Patty said, those 3 on sites. And in those communications, they're going to find out from you, how many residents you have. They're probably also going to want to know how many admissions you typically have as well, because on that second visit, they can, go ahead and give your new residents, the first dose of the vaccine as well. So you just want to keep those in mind. But those communications should happen directly with the pharmacy once they start doing communications to the facilities.
And I have one more question quickly for you on Echo Hubs. What does the Echo stand for, or does it stand for anything? ECHO.
I haven't seen that it stood for anything yet. I think it is just a type of learning that occurs, but I haven't in my calls asked that question. Just because they are just in fast mode to get everything set up. So the technical question I haven't asked, but I'll see if I can get that for you before our next week's call, and then we can let you know specifically what ECHO stands for.
Yeah, no, it's probably some acronym, very, very creative. But anyways, so I want to thank you guys for joining us. We're right at 2 o'clock, or maybe 1 minute over. If you have questions, please feel free to reach out to any of us anytime. You can always email info@caf.org if you're not sure who you need to get to. CAFdisasterprep.com as well as caf.org have a number of resources for you. And these webinars are always put onto YouTube on Mondays. So if you have staff that need to rewatch this or anything like that, they can go to the YouTube page. So I want to say thank you very much. Hopefully you guys have a wonderful weekend. We'll talk to you next week. Thanks.